Nice to
Okay.
have this working.
Morning, everybody.
Morning.
Thank you so much for being here. Carol and I are really excited to
Do you have a microphone?
talk to you about Medicare for All. I'll let Carol introduce herself.
See, there's a lot of noise outside.
I know, I don't know what.
Yeah.
Do you have a microphone?
I think if you move up and speak up,
Yeah,
You'd be
move up and speak up.
you're gonna have to kind of yell.
Okay. So I think you probably all read
Oh,
this.
yeah, we've read that.
Okay. So and Carol was actually working on this for a lot longer than I have. I'll let her tell you a little bit about it before we begin.
I started back in about 2008 with the league and with a national group, and we are called Healthcare Reform for the U.S. And so we passed a resolution at the National Convention in 2010. We've had caucuses at the National Convention. So we've been working on this for a real long time. Medicare for All is not a new thing. It's a thing that's been around for a long time, but we think the time is now for it to happen.
And I joined just 3 years ago, but my main focus the whole time has been working on first healthcare around the world, and then Medicare for Medicare single payer, because that is the league's position, that single payer would be their position. So what I'm going to do is I'm going to first start out by giving you just a little bit of history so that you know exactly where we've come from, and then I want to talk about where we are right now, which I'm sure a lot of us know, but we'll go over it real quick, and then what would we like to have, and what's out there, because there's so many programs that are out there. There's probably a lot of questions about that, and then how do we achieve that? So just a little bit. Oh, that's right. I wanted to tell you that because this presentation is about myths and facts, I want to let you know that the facts that I've pulled together, I've researched so many different sources, pulled them all together, but the Organization for Economic Cooperation and Development, you'll see that at the bottom of some of my slides. Over 50 years, they're one of the most respected organizations, not only for healthcare, but of a lot of things. The Kaiser Family Foundation and the Commonwealth Fund. What I thought was interesting about the Commonwealth Fund is a woman started it in 1918. And she was all about health for kids to begin with, and today it has grown into, they are the organization that puts together a whole worldwide statistics on healthcare every November. And so I pulled a lot of statistics from there because they're very well respected for putting together factual information. So that's why I thought that was important. Now, universal care was first proposed and championed by Theodore Roosevelt in 1912. But, and I gotta tell you a real quick story, because I went to a presentation with three speakers 2 weeks ago at the Democratic group, and one of the speakers talked about nothing but history, and he told the story about George Washington, who had the government pay for all of his men to be, what do you call it, inoculated? What do you call it?
Vaccinated.
Yes, vaccinated for smallpox. And many people felt that that was the turning point in the war, and that's why we won, because when the British came, thousands and thousands died of smallpox. But the General Washington's men were fine. So I thought that was important. Then Franklin Roosevelt in 1935, President Truman included as part of his 1945 Fair Deal. But nothing really happened until we had Medicare and Medicaid over 55 years ago in 1965, and it was supposed to be for everybody, but this was just going to be the beginning, and we all know what happens with incremental steps. 54 years later, we're still trying to have it, still trying to get our Medicare. In 2003, John Conyers introduced, improved, and expanded Medicare for All. It was originally crafted by physicians. He worked on this his whole life. And then in 2010, of course, we know the Affordable Care Act was passed, and that brought us a couple of other incremental steps toward health care for everyone. And then the midterm elections, we all know what happened there. Many candidates ran on that, and they won. So that's why Carol was saying, now is the time. Now is the time. Back in the 1990s and 2000s, there were some people that were working on it, but now there's groups all over the country working on it. The League of Women Voters, Healthcare for All Y'all in North Carolina, HOPE, healthcare over profits, huge organizations, small organizations working on Medicare for all, single payer, to get us to where we need to be for our healthcare. Now, what we have right now, we'll just go over this is, first of all, companies. Companies are really, we wouldn't think this, but companies are really having a hard time going out of business because, as Charlie Munger, Vice Chairman of Berkshire Hathaway, said, our cockamamie system gives our companies a big disadvantage in competing with other manufacturers. It's bad for their workers because they're paying so much in healthcare, and then they have to pass on more and more and more to their workers, and it's bad for business. Hurts the bottom line. There was a study done by, these are companies that are over 1,000 people. These are the CEOs, and they said, you know, they acknowledged the strain on healthcare costs placed on their companies, but if they didn't have to take months out of every year working on what are we going to do next for our people, how are we going to handle putting all these extra healthcare costs into our budgets, we could have better technology, salaries for employers, and new products and services. So they're in a stranglehold by these high costs from the insurance companies and pharmaceutical companies. Another place that we're at is that 1/3 of the GoFundMe donations are to cover medical costs. So you're sick, you're worried about your family, you're worried about yourself, and you have to go on the internet and beg your friends and strangers for money. Oops, go back one. $650 million on GoFundMe each year to attack the rising healthcare costs. Another thing is that we're the most expensive in the world. Remember I told you I did the Healthcare Around the World report? We are the most expensive. We're the only country that does not have healthcare for all of our people. So what they did this is the OECD. They took the top 19 countries, wealthy, industrialized countries, and this is how much they pay each year in 2018. Under 4,000, all the way up to Switzerland, that pays just a little bit under 8,000, but here's the average, 5,221 of all these countries. Ours is $10,229 per capita that is spent on healthcare. This was one of my favorite slides. When I found it, I thought, okay, this might be one of the answers why. This is probably the answer why. Before that and up to the 1960s, healthcare, and this is a Canadian statistic from the Institute for Health. They're going like this. They're going, and then all of a sudden, 1973, something happened. In 1973, Nixon had some healthcare people, insurance people, come to him and say, we want to be for profit. Before that, insurance companies were a service industry. Blue Cross Blue Shield, everything was a service industry. In 1973, they passed a bill that sounded really nice, Americans' Health for the Future. But what it did was it gave insurance companies they could be for profit. And look what's happened since. We have Canada still hanging out at around 11% of their GDP, and we're up near 20%. I just think that slide says volumes. So here's one of the myths. We pay the high premiums because we have the best healthcare system in the world. Does anybody still believe that? I used to believe that. I did. I thought we did have the best healthcare system in the world. But as you can see, higher U.S. healthcare spending does not mean that we're going to have better care. So if you can see this, and this was by the Commonwealth Fund, they scored it according to care process, access, administrative efficiency, equity, and health outcomes. Okay? UK was up here at the top, high performing, and we were down at lower performing. And there's all the different countries in between, France, Canada, Germany, Norway, and the Netherlands. And one other significantly thing that we're worse, and I'm sure a lot of you have heard this, is that our life expectancy is down to 78.8 years. 83 in Switzerland, and you can see it goes up for here for the other countries. In the 1960s, we had the longest life expectancy in the world.
You had the what?
longest life expectancy in the 1960s. See, I'm just talking, I'm not following my notes. Carol, are you following the notes by any chance?
No, but I know.
Because in the 1960s, there actually was a percentage. Okay,
In the United States, women dying at birth were the highest in the world.
That's right.
maternal death rates, you can see everybody else is down here.
So
or up
healthcare,
here.
costs, so it's also an economic thing for people. Race is another thing, it's black women that are.
And then here's the black women. African women are more than twice as likely to die than their white counterparts. So this is a life and death thing. This isn't just they get treated differently. So what would we like? I put together, if we had $3.65 trillion, what would we want to include? So I thought universal, affordable, accountable, accessible, comprehensive, high quality, evidence-based, equitable. Does anybody have one else they'd like to throw out?
When you're talking about universal, right now, the big push is Advantage programs.
Yeah.
And the Advantage programs are really great as long as you're within
That's right.
a county or a state.
Ask your doctor about them too. A lot of doctors hate them.
And so then you have to have a doctor that's in network. Well, I
That's right.
happen to be a snowbird.
Yeah.
I have an Advantage program because that's what my employer offered. So when I come out to Arizona, we just pray. That's our healthcare out here.
That's
That
right.
you don't gotta get sick.
So improved Medicare for all is actually quite simple. I know it's a cartoon, but it really kind of shows. Single payer just means one single payer, as opposed to the chaotic system that has all the bureaucratic inefficiency and waste. So one payer that's paying, they collect the money and they pay it out. It's important because decisions are left up to the healthcare provider and the patient. So that middleman that Carol's talking about, there is no middleman. The insurance companies are not standing between you and your doctor. Private companies make decisions about our healthcare based on their bottom line, not necessarily the medical necessity.
So some people don't understand what that single payer, one entity means. Right now you've got hundreds of insurance companies with thousands of policies, and so your doctor has to have all the staff because, well, you gotta submit this here and that there, and you gotta have the right coding, and so you're paying for that middleman that's just denying your care or making it very difficult for a doctor to
I think
receive
if
it.
you compare it with like Social Security.
Yes. Rivko?
By the way, one of the things that I heard many years ago is that one reason why the New Deal did not include health care was because the Southern Democrats
Yes.
did not want to have a universal health care system because they didn't want black people included.
That's true.
Just like Social Security
Right.
Yes.
did not include agricultural workers and home health aides,
Right.
those kinds of people, because that was the jobs that black people in those days had.
That is so true. And I read the history,
It didn't.
and just that little overview, there's so much more. Like Rivko said, every single time it was tried, there was something like the prejudice in the South, or when Nixon was trying to do something. Well, we know what happened with that. So he quit.
There's always
So,
a reason.
there's
always
always
a
a
good
reason.
reason not to pass it.
Yeah.
And it's, in this presidential election,
Mm-hmm.
there's so many reasons that it won't work. Instead of having visions of this is how we can make it work.
Exactly. And the presentation I listened to that I told you about a couple weeks ago, the person that talked about history, he was so funny because he kept saying his line
It
was,
eliminates
well, and
premiums
something got in.
quotas.
He would say,
Yes.
well, something got in the way, and then he'd go to his next slide. Well, something got in the way. So it's gotten in the way all the way up until now, which I think we're ready for it now. So improved and expanded Medicare for all. This is important. Improved and expanded. Because a lot of people think that because it's Medicare, it's what we have now. But it's not going to be what we have now. Healthcare for all for life. Of course, it saves money while expanding quality care. It covers all the health needs. So it's not what we have now, it's improved and expanded. A lot of people leave those words off and then it gets confusing. Primary care, emergency care, mental health, addiction treatment, prescription drugs, medical devices, dental, vision, long-term care, both home-based and institutional-based. Freedom and flexibility, of course, patients choose their doctors because there's no networks. You can feel free to travel to the United States, and if you're ill, go to a doctor. Efficiency plus negotiation equals lowers cost. So it slashes the bureaucracy and administrative paperwork, and it negotiates prescription drug prices and services. It eliminates premiums, co-pays, deductibles, and insurance. And I put a piece of paper on the table so that you could write down questions if you have them. Of course, if you have one in the middle that you think is just a really burning question, ask it, but I might go through it. But write down what these fees are for you. I just paid $2,000 to go to my dentist to get some teeth fixed. That's an out-of-pocket expense. Well, that wouldn't happen. So premiums, co-pays, deductibles, and co-insurance, because that'll be important when we start talking about what the cost might be. Healthcare services remain private, and that's a huge one for another one of our myths. The obstacles, what's standing in our way, what's stopping us, what are these myths? So I have insurance through my employer, why would I want to change? So, you know, these 152,000 people that they say are going to get kicked off their insurance. Okay, Carol. A typical U.S. family of four covered by employer-based health insurance pays in total around $20,559 per year. So if you ask people, they don't all really love their health insurance. They might love their doctors, but they don't love their health insurance. That's one of the myths. And plus, we're not going to be kicking people off because we're giving them all the things they have. They're just not spending all these co-insurance and co-pays. So that includes the insurance premiums paid by the employer, the premium paid directly by the household, and the extra costs including deductibles, co-payments, and out-of-network payments. That's that figure, the average family of four. So this expense flattens wages. We were talking about that in that first slide. It deters hiring and weakens competitiveness in the world. Employer-based insurance may also tie employees to a job they may not like. I'm sure everybody knows somebody that said, oh, I can't quit. I've got some kids, I've got to keep my insurance, or I can't start that new business because I need health insurance. And then there's employer-based insurance may also tie, okay, we got that one. MCS Industries is the U.S. market leader for wall and poster frames. I wanted to use them as the example for the businesses because the man that leads this, what's his name? Masters, put together some amazing documentaries which are on the trifold. Fix It. I don't know if anybody has seen that one, but he goes into great detail about what this is costing businesses, and he's one of the men that goes around talking to businesses about how Medicare for All can relieve them of all these costs. So in his particular case, he has 200 employees, pays $2.7 million to cover their health. 27,000 is his payment per family. That's $13.50 an hour per employee that he pays for insurance that he could be paying them. And his point is, it's like a big family. This business they've been in business a very long time, and they're all very proud of what they do. And he would love to be able to give his employees increases and not pass on insurance costs to them, but he has to stay in business. And they all get together and they work on how can we stay in business and still cover all of this insurance. That's 22% of his payroll. Now I wanted Carol to tell a story because she has examples of both family and personal that's happened to her, all in her family.
Another thing he's paying 22% of his payroll, but this year 2 of his employees got hepatitis. And so his insurance is going to go up another 16%. Businesses can't stay in business like this forever.
Right.
So my personal story.
Carol.
My husband was a GM employee for 38 years. He was an engineer, and when he retired, he signed a contract that we would have insurance for the rest of our lives. However, when GM had all the struggles, they cut out that insurance. So it didn't matter that we had a contract. So if you've got a really gold plan right now and you think, I don't care because I've got great insurance, I don't need to worry, you don't know that tomorrow you may not have that insurance. So when we lost his insurance, I was retired from Genesee County. So we went on my insurance, which is the gold standard of insurance. Now, his policy was totally paid for by GM. Well, when I retired, I was working part-time, so I still had to pay half my premiums, which are about $436 a month, which is pretty darn cheap if you have to buy your own insurance. You know, my son pays a month $1,144 for him and his wife for terrible insurance. It's really catastrophic. So families today are really struggling trying to pay for insurance. So, but we thought, this is great, we got this great insurance. Well, I went home, I'm from Michigan, went home this summer. Lo and behold, the county hasn't really been funding that fund properly. And you know, when they started this, when we retired, they weren't paying that much, like you saw on the other slides, maybe $5,000 per employee. Well, every year those premiums go up. Well, in Genesee County, we now have more retirees than we have people who are employed. And because I'm in the Flint area, a lot of people are moving out, so your tax base is going away. So they had good intentions of continually giving me great insurance, but this is where they're at today. So we've had to hire 2 lawyers to make sure that we're keeping our insurance. But in reality, what are you going to do when you don't have the money? So this wonderful insurance that I have, well, eventually they did fund it for 1 more year out of their savings while they determine what they're going to do. However, I'm sure I'm going to be paying higher premiums, higher deductibles, and I'm not going to have that gold plan anymore. So this whole thing, when you hear this, I don't want my employer insurance, I want to keep that. I have great insurance, I want to keep that. That's an argument that the insurance companies are using as propaganda right now. The reality is, just because you have great insurance today doesn't mean that you're necessarily going to have great insurance tomorrow, because they keep raising the rates. So employers are having a hard time. Everybody is having a hard time. And so when you hear this propaganda from the presidential candidates and the media and everything else, you need to know what's funding and behind that. That's really the insurance companies. What?
Well, I belong to the Arizona State Retirement, and apparently they have a pretty good funding system.
Right now. But the prices keep going up and up and up. This is happening. Our lawyers that we hired to try to protect our insurance.
That's another cost.
That we're paying out of pocket now for these lawyers. They're saying this is happening across the United States for cities, counties, states. It's happening everywhere.
Yeah, in Texas, I'm a member of the Texas State Employees. They have a law that requires the funding to be at X percentage of expected payouts. And they've done that, but the consequence is they have not raised the pension for any state employee in 20-some years.
Wow.
The only exceptions are law enforcement. So while that's wonderful for health insurance, it's not wonderful for the retiree who was a low-wage earner, because their income is eaten away gradually by inflation.
Exactly. Thanks, Carol.
I don't see them. I don't see.
So the next myth is that single payer Medicare for all is socialized medicine or a government takeover. So this is another one created to really scare you, because this started, in fact, Wendell Potter, who was the gentleman I was telling you about earlier, that's working across, did I tell you already that he's working across the country with businesses to tell them exactly about what Medicare will do for them? And he already has his organization that's just been going for a year. 2,000 companies that are on board with Medicare for all. By the end of 2020, they want to have 10,000. That's their goal.
See, I don't know if you know who Wendell Potter is or not, but he used to work for the insurance companies. And he worked for Cigna when Clinton was trying to get health care. He's the one that helped kill that. And he has a change of heart, and he's now on the other side, but he knows that what they're doing.
Mm-hmm.
He knows all their tactics. So he's now helping us instead.
Exactly. And he's working also to create those films to talk about healthcare, which we have the links to. So what really is the truth about socialized medicine is that it means, you can go to the next one, is that they're government employees. That means they're government employees and the hospitals are owned by the government. That's not what we're talking about.
Like the VA is the
Like
example.
the VA, or like the UK. Out of all those countries we were talking about, UK is the only one that providing healthcare for everybody that really is socialized medicine. They own the hospitals and the doctors are employees. But did you happen to notice the UK was one of the ones at the top and they paid half as much? So, but they're the only one with real socialized medicine. All the other countries have figured it out. They've figured it out differently, but they've all figured it out based on their countries on how to cover everybody. So we have to remember that single payer system financing is public while the delivery remains private. So you still work with your doctor and providers and patients make the decisions about their care. Does anybody have any questions about that one, about the socialism one? Because that is so important. And that was started back after the war as a big thing to stop. That was one of the things that they used to stop healthcare for all going through. Because people were afraid of, back when it was the communist after the war, they knew that that would scare people. But because of that, people still have this socialism idea, and so that scare still comes in. But that's not true. It creates waiting lists, and it would result in rationing of care. Well, that's not really true either, because the US, if you don't have insurance ability to pay, there's no waiting list, you just don't get taken care of. The European style single payer systems, there's some elective procedures that have waiting lists, but they are rarely, if ever, waiting lists for medically necessary or emergency procedures. Now you might have them, they'll call in somebody that has some really amazing story that's happened to try and prove the other way, but there's always going to be something that happens for a waiting list. There's always going to be something. Oh, okay, so I have a friend that came over the other night, group of people, Tom, his arm is in a sling. I said, Tom, what happened? He said, well, I hurt my shoulder, and I went to the doctor, and he said I needed an MRI. He said, okay, the insurance company turned it down. Doctor and Tom spent a week, we need this, we need this. Finally, he got it approved, so a couple weeks down the road now, he's got his MRI, goes back to the doctor. Doctor says, oh my God, you need surgery immediately. 3 weeks later, he got an appointment for his surgery. So we have waiting lists too. We have wait times, we have all these things.
But not for it won't be for medically necessary things. In Canada, if you have a heart problem or cancer or whatever,
Right.
You're not on a waiting list.
You're not on a waiting list. And I'm sure everybody has friends from Canada, and when you talk to them, one of my friends said, I said, how much do you pay for medical insurance? She goes, I don't know. It's not a big cost to them, and they know that they can go to the doctor whenever they need to go. Doctors will never buy into single payer because it'll interfere with their autonomy and decrease their salaries. Well, this one isn't true either, because if the doctors don't have to pay those huge staffs, okay, let's start up here. More than 60% of physicians already support single payer system. Physicians for a National Health Plan is another one of the amazing resources. You can go to their website. It's got so much wonderful information. And more doctors every day are supporting it because they see what they're going through. I was listening this morning to a doctor from PNHP, and he said that it's actually a nationwide, it's a huge problem because doctors are getting, what do you call it? Not frustrated, but burned out. I'm sorry, burned out. And it's affecting how they treat their patients, but they don't know what to do about it because they can only, they're fighting insurance companies, they're having staffs, it's business, they get to see their patients for 10 minutes, and they're getting overwhelmed and burned out. And that's what a lot of doctors are saying. The AMA is working on it, and a lot of other organizations are trying to put up programs to help the doctors. Private companies currently restrict physicians' abilities to practice medicine. Obviously, they do it all the time. Under single payer, decision making will be returned to the healthcare providers and their patients. So Tom went to the doctor, you need an MRI, okay, get an MRI, okay, you need surgery. The insurance companies wouldn't have been in the middle. The only ones might be the specialists. There might be some disparity there, and those are the people that are against it.
Because they're making a whole lot more money.
Because they're making a
than your
whole
primary
lot
care
more
physician.
money. Okay, here's the one that really struck me. In Canada, $22,230 is how much it costs them to run their offices. But in the U.S. they spend nearly $83,000. So immediately you add almost $61,000. Of course, this is average to the doctor's income. Plus, the stress is reduced. They can do what they were trained to do, what they love to do, why they became doctors. They can have more patients. They can spend more time with their patients, which will increase their income as well. So there's very little change that'll happen.
They don't have to fight with the insurance company of what they think is the best medication or the best treatment.
They don't have to do any of that. They can spend all of their time working with their patients, spending time with them, getting to know them, and there'll be more patients. Obviously, if Medicare for All starts, there'll be more patients to work with. Is healthcare a right? Well, instead of arguing about this one, we thought we'd go a different way. So even if it's not a right, single payer might still be the wisest public policy because of its moral and economic benefits. The moral benefits, 45,000 Americans die each year as a direct result of being uninsured. It's just a fact. And that was a figure from 2 years ago. So my point is, if my facts are a year old or so, because it takes a while it's still a point to be made that there shouldn't be anybody dying because they were uninsured. Economic benefits. The U.S. spends 50% more as a percentage of its GDP than most other developed countries, and we insure a lower percentage of our population with worse outcomes. So we spend more and we get less. That's not a good economic policy. So when I answer that question, for people that I know, the economy really means a lot to them, I'll say, but it's really a good economic policy too. Plus you have a healthy population, which creates healthy business, which it just snowballs up. How can we possibly transition from our current system to a single? It seems impossible. That's true. Okay, there's already 2 bills that have been taken years of research to make sure the transition is possible and smooth. The payment and provider structures already exist, so that's the Medicare. It's been going for 54 years. We have the structure. 10,000 people will join Medicare today. 10,000 every day. And we have the structure to take care of people joining the system, and it's already in place. They instituted Medicare in the 60s in less than 1 year without computers. I thought that was really good when people started saying, oh, it'll be impossible.
But we were a much, much smaller country with a much smaller older population, so.
Yeah, much smaller, but still, there was a lot of people all at once. It wasn't like.
Yeah, but I think that's kind of a iffy comparison.
Right, because the pyramid was like a pyramid should be, and they say by 2050 every worker will be supporting 17 people
Oh my gosh.
who aren't paying in.
That's right.
That's an issue.
That's an issue. That's an issue. It'll cause massive new taxes and inflation. 100% of nonpartisan studies, 25, found it keeps costs flat or they decline. And the Koch brothers had a study that said that Medicare for All saves money while expanding and improving coverage for everyone. But they hid that and took out the pieces that they wanted to show you. So this is just another way that.
Well, also, taxes on whom? You know, right now, the billionaires are paying, since they passed that new tax law in 2007, the billionaires are paying less than anybody else,
Right.
including us. And then you have companies like Amazon who are making billions of dollars and paying no taxes. So when you have an equitable tax base and everybody's paying taxes, then you have money to do things like this.
Thanks, Carol.
Oops.
Elizabeth Warren says you can do it on 1% of their money.
If you've read her bill, you know, there's $1 trillion here and $1 million here, and you know, like the
It adds up to real money.
if you yeah. You know, me, I got my budget and I'm subtracting and adding, you know, but trillion and millions is like above my head.
Single payer is politically unfeasible. So here's the guy from the insurance company, and here's the Congress, and he's saying, and in exchange you say we can't afford health reform, because this really is a huge problem with lobbying, 3.4 billion on lobbying, and 709 million in campaign contributions over the time period of 2006 to 2012. And it's bipartisan. It's everybody's being.
It doesn't
given
matter
money
if you're
to their
Democrat or
campaigns.
Republican right now.
No.
You're almost all of them are receiving money because campaigns are so darn expensive. So campaign finance reform really should be at the top because that's what's feeding all this.
Mhm. So what Carol and I are really trying to say is we're trying to help give you the facts so that when you hear those things, you don't go, oh, you know, that might be true. It's just not true. Universal health care umbrella. Many plans are being offered. So here's some of the plans that we've been hearing about. Strengthen and fix the Affordable Care Act. Expand Medicare and Medicaid eligibility. Develop a public option. Leave it to the states to create their own system. And single payer Medicare for all. So what's the main difference between them? And Carol and I have tried to study these extensively, but there is really only a couple of differences between all of these and Medicare for all. The astronomical admin costs continue due to complicated, inefficient, multi-payer system with dozens of insurance companies and thousands of policies. So all of those other four continue to have the insurance companies. And when it comes to Medicare Advantage, they're inching forward. They almost have a third of the seniors doing Medicare Advantage. And I've heard so many times from people say that just ruined Medicare because it brought in the privatization of Medicare. And that's public money paying for private insurance, and it's really maddening. Medicare should have stayed Medicare without the insurance companies coming in. Thus there will be no financial savings while adding the expense of covering other people. So there's no savings then if all the insurance companies are still, but we'll have a lot more people to cover. 30 million people will still be left uninsured though. And such tinkering around the edges does not solve the problem of a dysfunctional system based on profit. So it's another incremental step. People think, oh, well, I'll just do an incremental step again, and then people will go for that because it's not as hard as it is to get something totally different. And here's another graph to say almost the same thing from the Physicians for a National Health Program. Guaranteed coverage for all, single payer, yes, public option, no. Eliminates co-pays and deductibles, it does not. Public option does not. Covers all necessary care, public option does not. Ensures choice of doctor, no. Controls costs without compromising access to care, no. And single payer will do all of that.
Oops.
I was just wondering what the. Okay. Who's behind these incremental Band-Aid solutions? Well, I think from talking about the insurance companies and pharma, we kind of already guessed that. But there's a group called Partnership for America's Healthcare Future. Doesn't that sound good? But Carol, I want you to explain this one. You know so much more about Partnership for America's Healthcare Future.
So the insurance company. The insurance companies, all these conglomerate hospitals, I don't know, CBS has had some really good reporting on the news at night and how you can go to this hospital for an MRI and it's $350 and you can go a block away and it's $3,500. So these hospitals are all joining together so you have a conglomerate and they can charge whatever they want to charge. So this Partnership for America's Healthcare Future is really, they're pooling all their money. The medical device makers, all of them are pooling their money, and then they've hired this PR firm. And so they're the ones that are, let's see, given thousands and thousands of dollars. And so they're going to Congress. That's who, you try to get in and actually talk to a congressman yourself, it's very difficult. My congressman said, you know what, I'm in a 4th of July parade, why don't you come walk with me? Or, can you come to Washington? You know, it's very difficult for some of us to talk to our congressman. But these people, and you know, they're so smart, they hired a Democratic PR firm to go to the Democrats and talk to the Democrats. So they're the ones that are getting all the information out to both Democrats and Republicans and to the media. I mean, are you as sick of all these ads on TV for all the Advantage programs right now? You know, so the media doesn't want to get rid of it. I mean, look at the money that they're pulling in. So it's very hard for us with volunteers across the United States trying to get the word out when you've got them spending millions and millions of dollars to protect their billions in profits.
Maybe that's what I want.
And I thought this was interesting too, their propaganda campaign, Create Fear, Uncertainty, and Doubt. Wendell Potter talked about that way back in the 90s when he was working for Cigna. So then they make no bones about letting everybody know that that's their campaign.
Like you don't want to take away my insurance and give me this other policy. Of course, this other policy covers everything.
And it's better.
And how many people, their policies cover everything across the United States. But isn't that a good scare tactic?
And they always say they're going to knock 152 million people off their insurance.
And these unions, you know, after all, they negotiated their contracts. Hey, I'm from Michigan. I don't know if you watched the news or not, but they've been on strike. And so one of those issues that they were fighting for was to keep their insurance. So just because the unions got insurance way back when, they're still fighting for it and having to use it in their negotiations. So
And they took less, if I remember reading the article. The people took less in pay to keep their
Yes.
insurance in the General Motors strike. Okay.
Are we past it?
Yeah.
Okay.
So these guys are gonna try and stop it. And then the people underneath them, just because they make 58 million doesn't mean that the person underneath them makes a normal salary. They make millions as well.
And Wendell Potter also said their board members make millions.
Yeah, I've never understood that.
Well, that's our premiums.
Yeah.
Okay, Big Pharma's ripping us off. It says your money or your life when she tries to get her insulin. So the price went from $21 to $275, 1996 to 2017.
So even though we're nonpartisan, an example was when Bernie Sanders came to Michigan and he took people across the border to Canada for their insulin, and it was 1/10 of what we were paying just across the border. It's a good example.
And did they publicize it in the Michigan papers?
Oh, yeah.
Oh, good.
So here's the pharma myths. You know how they say that, but if we didn't pay that much, they wouldn't be able to do their research and development, and we have all these great, no. You see this little teeny sliver? It's clinical trials. How about detailing face-to-face sales and promotional activities?
Every other one of those is some form
Marketing.
of
Direct
marketing.
to consumer advertising. Promotional mailings. Educational and promotional meetings. Samples that they give to doctors.
Do you have a percentage chart of that? I mean, I know I can do it because you can
I
just do
don't.
the math.
I don't, but I could do
Because
it.
that would be, I think the percent
Mhm.
of the total would be really, really, really important.
And this was in 2012 from the Pew.
So it'd be
Trust.
much worse today.
But it's much
Good.
worse today. But I like I said, I want to make a point because we know it didn't get better.
You don't want this one, do you?
Okay, so solutions and recommendations. Okay, this right here is how much the government already spends. And this was surprising to me because I know about Medicare and Medicaid, but the ACA, of course, the subsidies. TRICARE, that's for veterans when they go to other carriers besides the veterans missiles. CHIP for kids, the federal employers, all the way from the president down to everybody that works for the government. That's all paid for by the government. That's 2/3 right here. That's the public money. Households pay premiums, co-pays, deductibles, and insurance. So that's the insurance companies here. When we buy our own insurance policies, when our employers pay into the insurance policies. So what they would do is, they would take the existing public funding They would add new public dollars to pay and have Medicare for all. So it would replace what you're already paying the private insurance companies. That's why I said, think about all the money you're already paying, so that you know if, well, I know some of the plans have, you know, the billionaires paying for it, but let's say, my little story that I didn't tell you right up front, but I'll tell you real quick, was we were paying $900 a month, then $1,000 a month, then $1,450 a month, and I was just getting stomach aches, and then in November of 2017, I got a notice from Cigna that I'd be paying $2,500 a month, plus $7,500 deductible for each, my husband, and we never go to the hospital. We're not sick. My husband doesn't go to the doctor, unfortunately, but you see what I mean? So we became one of the underinsured. There's more underinsured than there are uninsured. So I, luckily, a year later, went on Medicare, but my husband still has one of those, what do you call his policies? Catastrophic, and it's still $1,000, but he's at least catastrophic if something were to happen to him. So that's one of the underinsured. So,
Oops.
no, that's okay. I think, was there any questions you had on that one? Okay. Okay, so this is another question people have. Well, the impact of transition to Medicare for all on businesses by size. Every one of them would pay less. Small business with 0 to 9 employees with health benefits, minimum size, medium size, large business 500 plus. They would all pay less for their health insurance as they transitioned. I don't know if you can imagine, based on what Masters was saying about business, what that would do to build business.
I'm having trouble hearing because of the outside noise.
I know.
Not you, it's
So remember I was saying Masters, the one that owns the business, was saying it was so hard to keep his business going with all his employees working together to figure out what they could do when the insurance rates went up. Well, the transition to Medicare for all would actually save businesses these percentages here, from 12.9 to negative 9% here, if they went for Medicare for all. So I'm just thinking, can you imagine what then businesses could do, how the economy could expand? People would have more money, they'd have more money for growing their businesses, paying their employees. So I put this just in this morning because I thought this was such an amazing comparison of the transition. People have an idea what's going to happen in the transition. It's going to get better.
Ask you though, are businesses paying a health care tax or just paying more taxes in general to cover what they were paying?
They're
Well, I
paying the
suppose-
insurance companies.
What?
They're paying the insurance companies, aren't they?
But it's important to remember.
But are they gonna pay it to the government?
Oh,
in
yes,
increased
yes,
taxes
yes,
or
yes.
in a health care tax?
See, I think that'll all be decided.
Yeah.
I
think
In Canada, they use that one figure.
Yes.
That's for all employee related,
Okay.
and that goes to their retirement, their healthcare, whatever.
Okay.
And it was the last time I checked, 37 or 38% of your payroll, which sounds like a lot, but when you look at American companies and you add up what they pay in self-insurance, most are self-insured,
Mm-hmm.
and third-party administrators like their insurance company, and all the other things that you showed earlier, it comes out to be about the same. If I'm in business in the US, I'm gonna figure about 32 to 33% of payroll is what I need for all employee
All of it?
benefits.
Yeah.
401k,
Retirement, yes.
healthcare,
Yes, yes, yes.
Genesee
retirement.
County, it's 38%.
So,
And on families, 13,000, 35,000, 60,000, here's the underinsured, individually insured, all the way, top 5%, top 20%. So anybody making over 221,000, change in healthcare spending as a share of income will go up.
I
And-
can't read what's.
Yeah, I know it's, they're so little.
No,
But
just the final one, you said if you make over 200.
If you make over 221,000 in income up to 400, your percentage will go up 3.9%. Change in healthcare spending, and top 5%, 401 in income and plus, will go up plus 5.6%.
So,
Changing
so if
healthcare.
you guys are in that bracket, you probably don't like this plan.
If we're in that bracket, we shouldn't be here. We should all be eating a luxury lunch.
And you know, you guys, if you want, I know that I'm going through this quickly because we have a time constraint. I'll send you this presentation because all my notes are actually underneath it, and all of our research and all of our links and everything. So, and you can read
Are
it.
you going to put it on the league, internet for the league? Why not?
I think they're working on
I think
that
they're
right now.
working on
I
it.
mean,
Because they
the
usually-
webpage period they're working on.
Oh, I
And
mean,
yes,
it's something
and-
you have to
Well,
search for.
as a matter of fact, so we're gonna brag a little bit here. So this national group that I belong to has lobbied National League of Women Voters US. And we said, because you cannot find anything on their
I know,
website.
it's
And
the
it's
worst.
old. And so, before we had our caucus at the last convention, we put together a website because we're women from all over the United States, and so we were
And there are
combining.
links to all the leagues and everything?
And so, we asked National, so we lobbied National, we thought we got this great website, and we can then update it and keep it updated where they
Right.
don't update National. Lo and behold, they did it, they put a link onto our Arizona League website.
Good.
Of course, it was right when the webmaster quit,
Yeah.
and so we've never been able to update it.
Oh,
But
fine.
now supposedly, we got now a new webmaster and we're gonna be able to do that. So we have on the Arizona website, a link from National to ours, that everybody can go out and get all these resources, so across the United States, they can put on their own programs. So it's in process, simply because we're waiting for the webmaster.
Yep, and they'll send it to you too, so you'll have it right away. Okay,
Are we ready for questions?
well, I wanna, how do we pay for it? I think this is a big question that everybody has, is how we're going to pay for it. So negotiated prices on drugs, medical equipment services, lower administration costs, only one agency processing and paying claims, and the profit is eliminated, and that's 600 billions in savings right there. And people say, well, why haven't I heard about the savings? Well, because Carol was saying, the insurance companies are trying everything they can do to do that FUD, fear, uncertainty. Partnership for America's Healthcare Future is working very hard against it, and with hundreds of billions in profits at stake, they made $23.4 billion in 2018, up from $16 billion in 2017. They're not hurting, they're not losing money, which is another thing.
And that's after they're paying their CEOs and
That's
paying
net.
their lobbyists and putting ads on TV, so your profit may look not even all that big, but when you look at what they're spending your
Right.
healthcare dollars on.
Exactly.
Are we ready?
Yeah, so to summarize, oh, we're already paying for it. Yeah, that's, we really are already paying for it. So, we have high costs, we have bad outcomes, we have mind-boggling bureaucracy, racial disparities, bankruptcies, geographic inequities, and obscene profiteering on the backs of
That
Americans.
geographic inequities, you know, if you're living in an outlying area, if it's a for-profit hospital, they don't wanna be out there.
Yeah.
And so there's a lot of areas that don't have any medical care right there.
I know in Maine, they have islands
Yeah.
that have to go on radio, with
Yes,
they have
online.
radio
Yep.
and,
Yeah.
you know, vision and so forth.
So, based on the popular and proven Medicare health plan enjoyed by millions of Americans, this is how we can solve this. It's built on the current Medicare system, which is already funded by public dollars. We saw that 2/3 already funded. Adds more coverage like dental, vision, hearing, prescription drugs, and medical devices, and all Americans are eligible for preventative care and evidence-based health insurance.
It's not gonna cover a facelift. You know,
services.
it's not gonna cover
They're
everything.
necessary.
Yeah.
So, Dr. Adams, he's Physicians for a National Health Plan, said passing a Medicare for All system would buy our patients freedom. People would be out in the street demanding it if they really knew. There's just one other thing. There's another quote there that I thought was really cool too.
Did I skip it?
No, it was in the notes. Oh, okay, this is Dr. Gaffney, PHP's president. He's a critical care physician and faculty member at Harvard. Accept no substitutes. Only single-payer Medicare for all can fix the grave dysfunctions and injustices of the American healthcare system. Congress shouldn't be distracted by incremental plans like a Medicare buy-in or a public option. The only way to achieve universal and comprehensive coverage is to eliminate the profits and the waste of private insurance industry, which drains hundreds of billions of dollars from our healthcare system each year. So, you guys, we were asking the question about this is hard, right? But we ended slavery. Think about the huge, huge risk that was to do that. We got the right to vote. If anybody's really studied, I'm sure everybody's really looked into the history of what these women went through, what the struggles they had to get the vote for us. And we put men and women on the moon. And all these other countries have done it, their own ways, but they've done it. Together we should be able to get comprehensive, cost-effective, single-payer, improved and enhanced Medicare for all. And we can do that. We're educating ourselves right now. Contact your members of Congress and urge them to support single-payer, improved and expanded Medicare for all, which I know Rivko is working on to help all of the Phoenix people. Support and elect candidates who champion improved and expanded single-payer Medicare and reject corporate funding. Yeah, have you guys all noticed that a lot of people are rejecting the corporate funding? And they're very proud of that are running for office. Create coalitions that can advocate together. Meet with your members of Congress as a coalition. I think that's what we'll be doing on Legislative Day. Organize town hall meetings, presentations to civic groups and house parties. And women and men join the League of Women Voters. We'll show you how. So now, questions.
My question, I have United Healthcare, as I think I told you, I like my insurance. But I'm wondering, what advantage is it to my United Healthcare, to their bottom line, for them to encourage me to use things I don't need? I have Medicare Advantage, which includes almost everything, and I'm very happy with what it includes. But first they were telling me, we have the nurse line. Well, I knew they had the nurse line, but I don't call them all the time because I don't need them. Occasionally I have called them. I have used the nurse line. And then they say, well, how about us coming to your house and checking your apartment for choking, for falling hazards? Well, I don't want them to do that because I avoid falling hazards.
Carol, come up here to answer that because I know you've got Advantage and you know this.
And then they call me to ask, why don't you get your flu shot? Well, I'd already gotten my flu shot. And then they say, well, how about your physical? Well, I've already gotten my physical, So
Well,
it just frustrates me, and it must cost them money.
Well, they want you to do these things because
I've
if
done
you
them.
don't do these things, like if you have high blood pressure and you don't take care of it, you may end up on dialysis.
Well, I
It's a
know
whole
that,
lot
and I go
cheaper
to my
than
doctor
taking,
all the time, and I check all these things.
and another one that they're pushing now is gym membership.
Right.
Well, and I have that too.
But, so, I just read about this, which I didn't even register at
Well,
first.
doesn't it cost them money to do that, though? That's
No,
my
they want,
question.
they're going after healthy people.
Uh-huh.
They want
Right.
healthy people, they don't want sick people.
Medicare,
people cost more.
usually healthy people sign up for Medicare Advantage because it costs less, and people
It's cherry
that
picking.
want Medicare, they're
basically.
cherry picking.
Yeah.
People with Medicare are the oldest and become the sickest. So they're cherry picking. Yeah, they're cherry
If I
picking.
don't die first, right, I might get sick. So-
Right. And so all these,
But the thing is, Medicare for all has all that stuff.
But remember that what these ladies said, Medicare Advantage plans are subsidized by the federal government.
yes,
Right.
yeah,
They are
They're
not a
you're paying
private
for them in
plan.
your taxes.
Right.
No, I don't take dental anymore because I've never used it.
Yeah, but they're it's subsidized by
It
our
does
public
cost more.
funds. Medicare Advantage is now the insurance company's #1 source of income.
Yeah, they love it.
They love it. That's probably why they have all the advertisements on TV. They go, ooh, here's a great one. Let's keep pushing and getting all the Medicare people. It's, I can't remember
Well, I
the
think they do
percentage.
that for the young people too. I think
Oh, they
follow
want
that.
the young people, absolutely. Medicare
Well,
is
I thought you
old
said
and
they
disabled.
wanted old people because we would die.
No.
They want, that's why you have to have a
I'm old.
system
I'm
where you
90.
have young people, healthy people, along with the old people and the sick people. You have to put all that money into a pot. And right now, the insurance companies want the young and the healthy. And so who gets on Medicare is the old and the sick.
Well, I'm on.
But
Yeah, you are,
Yeah, yeah.
because they're making a lot of money off you.
Well, okay, that's
Yeah.
all right, but they will take care of me if I get sick.
So will Medicare for all, single payer. You're
Well,
just,
I know, but
you're-
I'm just wondering why they're spending money on me.
because they want you to stay
encourage me
healthy.
to do things.
They want you to stay healthy.
You're
Well, I
killing,
wanna stay
you
healthy, and
cost-
I'm
you cost them less
intelligent
money.
enough to know what I should do.
Right, they.
They cost them-
Yes, Rivka.
Well, I know,
Rivka.
but they should know
I
by now that
really
I don't want
appreciate
their
your-
calls. I'm beginning to not even pick up.
I appreciate you really focusing on the issue of how Medicare Advantage is funded, because I don't think most people realize it. Personally, I refuse to go on
Right, it's a
Medicare
subsidy.
Advantage because I just philosophically feel it is such a ripoff that the government is paying them to then be able to provide more things, which of course, and then they get more profit.
yes.
I have one other kind of specific question, maybe kind of stupid, but, have you read anything about how, what is it, what would be provided to all the insurance company workers?
That's built in.
Seriously,
It's built
you
in.
know, it provides jobs, it's just like all the
And
people.
all the
in
billing
doc-
departments and healthcare
Right,
providers.
so what, exactly, and all, I mean, you go into any doctor's office and a huge number of the people there are just processing, you know, I'm not paperwork today, but you know, that's what they're doing. And so, I mean, it's kind of a minor thing, but I've.
No,
Oh, no,
it's
it's major.
So
It's major, and they do have, I think section 5 of one of the bills has a 5-year plan for,
Retraining.
retraining,
Okay.
and what do you call that when you quit and you get money?
Unemployment insurance.
Unemployment, it's kind of like, it's not unemployment,
No.
it's,
It's like a parachute.
Guaranteed,
Yeah,
basic
training insurance.
it's something to support them.
Severance benefits.
Severance,
Okay.
that's it, it's severance, and then they have retraining, so that they can go out, because of course, there's going to be more need for more nurses, more, you know,
Doctors.
more doctors, more
You
everything.
know, that's the other thing I was gonna ask, where in all of this is the provision to increase the number of primary healthcare providers, not just physicians, nurse practitioners, physicians assistants, because none of this will work if we don't have enough bodies out there to provide the care.
Right.
Are there pieces of the legislation that speak directly to those shortages?
There,
Do you know?
there are 14 bills right now.
Yeah.
7 in the House, 7 in the Senate. The gold standard is Jay Appel's bill in the House.
Okay.
That's the best bill of all.
Whose bill?
Jay Appel, a woman from Seattle.
Thank you.
And so for us to say one bill has this and one bill has that, if it passes, if we get a president that wants to institute this, it's even gonna be written differently.
Yeah.
But that is, in John Conyers' bill, that was covered.
Yeah, I remember he was concerned about that.
Yes,
Yes.
yeah. And so I can't honestly answer that, I don't
I have
know.
to go look.
But they know that we're gonna have to have more people to provide services. So the jobs are going to be different. You're not gonna have the paper pusher, but you're gonna have the person that's helping in one way or another. So, and the Advantage bill, the other thing is, my husband needed to go to Cleveland Clinic. I spent all summer trying to get that okayed through my primary care physician, insurance companies, and Cleveland Clinic. I'm tenacious, I'm pretty smart. I worked all summer on this. I called the day before to make sure everything was still in line. We went overnight, stayed overnight, got on our shuttle bus going in the hospital. I'm called by Cleveland Clinic going, this has not been okayed by your insurance company. So you either say, yes, I'll pay this if my insurance company won't. I worked all summer to get my husband there. So he went in, and while he's doing this, I spent all day running from this office to that office and calling my insurance company to find out that my insurance company said, oh, that's a different division. You weren't working with the right one.
Yes.
I thought I was gonna have a heart attack or I was gonna kill somebody that day. So that's your Advantage
So what
program.
happened?
I finally got it worked out and they paid for it. But if you're sick, my husband could have never done this.
Yeah.
He was sick. So you gotta have somebody like me that's a pit bull And so when you're talking about advantage programs, as long as you stay right here and you like that doctor in that particular network, you're great. But if you want a different doctor in a different state or period that's
If you
not in
travel
network, you
at
fight it.
all.
Huh?
If you travel at all.
Yeah, if you travel.
I think it must mean if it's really a big thing like yours, because I've had
Oh, no.
I've had bills and other things, once I had a blood clot, and they easily took care of it in Georgia, I think it was, and then
The question is, do you want you want your healthcare dollars going to an insurance company that provides nothing, or do you want it to go for healthcare for all people? The money is there, it's you determining where do you want that money spent? Covering everybody or paying the CEOs?
This was wonderful. We have a requirement to
Yeah.
reorganize the room and be out of here by 11:30. And so, even though we're not
Rivko.
coming back to this room ever.
Would you come up there, please?
Oh,
Carol,
yes.
come here.
Oh, we're gonna take a picture.
I just wanna,
Let's take a picture.
we're just gonna say thank you before we turn off. Okay.
Thank you, bye. Bye. Oh, a picture, yeah. Let's get a picture.
I'm such an awful photographer. I shouldn't be allowed to do this, actually.
I've always thought I did.
Okay, 1, 2, 3.
Because people don't want it because they want their insurance, so we're covering.
Here's my,
Address that issue.
before you leave, let's,
I'm gonna turn this off.
did it go?